Good morning, everyone. Welcome to our program Back on Track. So, today is our first session of this program that's going to run for a few weeks. And for the program, I'll quickly explain what the program looks like and how will it look like over a period of weeks. So, Back on Track is a specific program made by qualified physiotherapists, me, as well as our sports scientists and strength and conditioning coaches. So it's a very clinically backed up program. Okay, this program is going to initially, address issues like spine mobility, hip mobility. But as soon as we run through the program in the future, you will see that there is more exercises that are being added up that gives a lot of idea about your core strength, your glutes, and overall, activation or strength, which is required to avoid any kind of back pain. Okay, I would say anybody who is currently facing with a chronic pain, back pain, maybe upper back pain or lower back pain, the program is going to be really helpful for them. So, without taking any delay, let's start with the first exercise for this first very session of the program Back on Track. Okay, so the first exercise that we are going to do is called as diaphragmatic breathing. Now, this exercise we'll be using today as a warm up, but feel free to use this exercise recurrently in our upcoming sessions whenever you're taking a break. Okay. So now, before actually jumping into the exercise itself, I want you guys to understand that what is diaphragm. Okay. So diaphragm is a muscle primarily just located above your abdomen in the epigastric region, and it's primarily meant is an important part of the core. Also, it is primarily meant for a proper breathing pattern. So, in case when you're doing a diaphragmatic breathing, I really want you guys to concentrate properly on your breaths. Take all that oxygen inside with your nose and breathe out with your mouth. Okay. So for the first exercise, let's start. I want you all guys to lie down flat on your back. Okay, keep your one hand over the abdomen of the epigastric region. The other hand is going to go on the upper chest. Now, you're going to breathe in with your nose and imagine that you're actually filling all that stomach, all the lungs with lots of air. Hold there for 2 seconds and then breathe out with your mouth. Okay, I'll give you counts. Do it with me. You're going to do 4 breaths, 2 sets. Okay, you may close your eyes in case you want to feel every breath that you're doing. Okay, so breathe in with your nose, fill your tummy with all that air, and breathe out with your mouth. Breathe in with your nose, breathe out with your mouth. 2 reps are done. Keep doing that. Make sure your shoulders, your upper chest is completely relaxed, and only your right hand, that is the right hand over the epigastric region, is showing some movements. Whereas the left hand, which is on the chest, upper chest, is not going to move or might have a minimal movement. Try to restrict the movement there. Okay, one more breath. Good job. Let's do one more set of 4 reps there. Okay. Same, hand over the epigastric region, one hand over the chest. Breathe in with your nose, fill your tummy. Breathe out with your mouth. Good job. 3 more reps. Stay as relaxed and calm as possible. Make sure you're not raising your shoulders. Keep it as grounded as on the mat as possible. Breathing again. One more. Good job. So that was our first warm-up exercise, which is called as a diaphragmatic breathing exercise, which helped us to take all that oxygen inside and let it all carbon dioxide go outside. Okay. Now, with a good start of this warm-up, we are going to move ahead of our program and let's start with a bit of mobility session today. Okay. So let's start with the first exercise, which is called as cat and camel. Now, for this exercise, we have to understand certain movements. When it comes to cat and camel, quickly explaining you the anatomy of our spine. So our spine is, made up of a lot of vertebrae there, stacked over each other. Okay, so each vertebra is stacked over the other, and there is a disc in the center, which is called as a intervertebral disc. As well as they are joined on the side with something called as a facet joints on the right as well as on the left, which act as the pillars of your spine. Now, when you move towards your right, left, front, or back, the facet joints are actually giving you a lot of mobility there. In case of a prolonged or a chronic back pain, or in case if you're doing a desk job or having a sedentary lifestyle, your facet joints goes for a toss and they become a lot of stiff and they generate a lot of stiffness in them. So for that, we are going to do a quick mobility. So today's session is more of a mobility session, okay? So let's start with the cat and camel. Now, before we start for that, I want you to understand that in a cat and camel, the facet joints are going to move in and around a very sagittal plane. Okay, so before digging into that, I want you to understand that our spine has completely, it has a cervical spine, it is thoracic spine, and you have a lumbar spine. Now, there are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae, and then you have a sacrum and a sacral vertebrae there. Okay. To understand further, it is also connected to your pelvis. Now, your pelvis has 2 movements. Okay. So if you align your pelvis with your shoulders, you might understand that there are 2 movements that will happen in your pelvis. One is your anterior tilt, where you are actually moving your ASIs towards the mat and you're exaggerating the arch there. Okay, so this is called as an anterior pelvic tilt. And there is a tilt called as posterior pelvic tilt, where you actually obliterate the arch there, okay, and squeeze your buttocks. So again, an anterior tilt and a posterior tilt. An anterior tilt and a posterior tilt. Okay, feel free to practice this as much as time as possible. In case of any doubts, please feel free to just drop it in the comment box, and I take the questions at the end of the session. Okay, you can drop your questions or any queries into the comment box. Okay, now let's start with the cat and camel. The anterior and posterior pelvic tilt that I've just shown you, we're going to use that component in our cat and camel exercise. Okay, so let's start. We're going to do 5 reps, 2 sets of cat and camel. To get starting with the cat and camel, go into the position called as quadruped position. Make sure that your shoulders are properly aligned with your wrist, both, as well as your hips are aligned with your knees, and your weight is equally distributed on all the 4 limbs. Okay, so do not lean over one side. Okay, now here, make sure your tips of your fingers are also feeling the weight of your body, so that you know that yes, you are equally distributing the weight there. Okay, now for the starting, keep following my instruction and let's start. Let's start with the neck. So tuck in your chin, bend your neck as much as possible. Feel that segmental breathing and feel the movement in the facets as well as your cervical spine. Now keep pushing the shoulders towards the ceiling. Now push the upper thorax, push the lumbar thorax, and slowly go into a posterior pelvic tilt with squeezing your buttocks. Now you have to do a reverse movement where you start an anterior pelvic tilt at the pelvis, Arch your lumbar back. Go with the thorax where your chest is moving, navel is moving towards the mat. And now start looking up slowly. Feel the good stretch and do the reverse movement again. Start by looking down. Make sure that you're feeling that your each vertebra is moving one by one, moving through the cervical, through the thorax or the upper back, then through the lower back, then a posterior pelvic tilt, squeeze the buttocks, and there you go. So let's do 2 reps are done. Let's move with the third rep. Do not hold your breath. Keep breathing normally. Good job. Again, you have 2 more reps. Let's do 1 more rep. Starting with the neck, looking down, pushing the shoulders towards the ceiling, upper back towards the ceiling, navel towards the ceiling, complete posterior tilt, squeeze the buttocks. There you go. Relax. Good job, guys. We have finished our 5 reps. First set. Let's do the second set of the cat and camel exercise. Okay. In case of any doubt there, I want you to drop down all the queries in the comment box below. Okay. Let's start our second set. The most important thing that I'm repeatedly telling you is to understand the segmental movement through each vertebra when you're doing cat and camel. Okay, let's do 5 more reps. Come on. Again, go into the quadruped position as I explained you earlier. Okay, and let's start the movement. Starting with the neck, then with the upper thorax, and the lower, then a posterior tilt. Now the anterior tilt, lower back, navel towards the mat, chest towards the mat, flare up your chest a bit, open it up, and now look up. That's your 1 rep. Okay? Let's do the second rep. Again, neck down, chest up, navel towards the ceiling. Keep pushing, go into the posterior tilt. Good job. Again, an anterior tilt, navel towards the mat. Push the chest toward the mat. Push the shoulders up and look up. Good job. 2 more reps to go. Keep breathing normally, guys. Do not hold your breath at any point of time. We have 1 more last rep. Good job. There we have finished our first exercise called as a cat and camel. Okay? Feel free to take a 10-second break and do the diaphragmatic breathing that I've already taught you. Sip some water, wipe your sweat off if there's any kind of sweat. Okay? I'm going to explain you the second exercise that we're going to do in today's program is thread the needle. Okay? Now, the first exercise that we did was working towards your sagittal plane. The next exercise that we are going to do is working on the rotational axis again for your facet joints. Not only that, it's going to help to get that rotational mobility throughout your, mainly through your thoracic spine. Okay, getting a stretch in the rhomboid muscle. Now, basically, what is a rhomboid muscle? Okay, so if you see, this is your thoracic spine, and then there are these 2 shoulder blades here. Now, the muscle between them is called as rhomboids. To get a really good stretch in those rhomboids, this exercise is very, very helpful. Also, in case if you're doing a lot of desktop and typing a lot for the prolonged period of time, it's rhomboids and the art postures for the prolonged period goes like this in a slouch position. So in that case, you might have an upper back pain, and this exercise is absolutely important as well as effective when it comes to your upper back pain. Okay, so let's start and work out with that exercise. So for the thread the needle, what I want you to do is go back into the quarterback position. Okay, I'm going to explain you 2 reps by this view, and then I'll just turn around myself so that you can see me better. And in case of any doubt, you can put it in the comment box again. Okay, so go into the quarterback position again. Now, weight bear completely on your right side, and your left arm is supposed to go under your right arm like this. Okay, so it's to go under your right arm like this. Make sure you're moving your left shoulders towards the mat. And as we go, our right elbow will keep bending, and that's fine. Okay, so let's do that. You keep going like that. Make sure your left shoulder is touching the mat, and the right shoulder you're going to push on the mat with the right and go. Rotate and look up. You're going to feel a good stretch there. Hold there for 3 seconds and come up. Okay, and then you just have to go in the opposite direction. Okay, so you do this and then just do this. That's your 1 rep. Let's do 4 more reps. Okay, 2, 3, 'Make sure that you're opening your chest properly. Do not collapse through your chest. You just have to open it up towards the ceiling. 4. Let's do 1 more. 5. Good job. Okay, now we're going to switch our hands and do that exercise again. Okay. Okay, now this time we are going to weight bear on your left, and the right arm is going to go under your left arm. Okay, let's start. Again, everything remains the same, quarterback position, weight equally distributed. Now lift your right arm, pass it under your left one. Make sure you're touching the shoulder when you're going down. Do not drop your thorax. Keep going like that. Keep bending that elbow and open up. So do not fall like this. Open it up, okay? Open your chest up and make sure that this, your right and as well as left shoulders is aligned properly. Okay? There you go, that's 1. And open it up. 2. Good job. Keep breathing normally. Breathe in and breathe out, okay? Do not hold your breath. 4, 5, 'Good job. Okay. Hopefully everybody has got that mobility till now in your spine. So the first exercise was cat and camel, the second was thread the needle. We are going to move towards our third exercise, which is called as an open book exercise, which will give you again a lot of mobility towards your lower lumbar spine as well as the upper lumbar spine. Now, this exercise, I want you guys to lie down. In case if you need a 10-second break, feel free to take it and do some diaphragmatic breathing and sip some water. Okay? I'm going to quickly explain you where you should feel the stretch and why is it very, very important. Now, when it comes to certain muscles. There are muscles called as quadratus lumborum, which gets tight if you're sitting prolonged in a slouch position. So the stretch that you feel through this muscle is really important. Also, when you're doing an open book, if you're a very, very beginner, you might feel a little bit crampy in this area, which is fine. Just take a 10-second break and join with me again. Okay? So let's start with the open book. For the open book, I want you guys to lie down. In case if you have a pillow, you can just take a pillow with you. Also, you can. Now, the important thing of this exercise is to get into this position. Okay, so right now you're going to do it on the right side. Okay, so you're going to lie down on your left and make sure it is 90, 90, 90. Okay, so if you're doing that, what I want you to do is palms facing each other like this on top of each other. Make sure your hips, knee, and ankle are in a 90, 90, 90 position and palms facing like that. Now, you're gonna also do not lift your knee off when you're doing the exercise. Make it stick to the mat. Okay? Let's start the exercise. You're gonna move it this way. Breathe in completely and open your arms up. Stretch the arms and open it that way. And breathe out. When you reach there, you'll feel a good stretch in this area as well as a little bit of QL if it's very, very tight. And then you come back. Okay? Let's start with our first step. 1. And you breathe out there. Come back. 2. Relax and breathe out. Come back. Again. 3. 4. Come back. 5. Good job. You're gonna switch the sides now, okay? So you're gonna switch and lie down on your right side. Okay? Everything remains the same. 90, 90, 90 position. We're just switching the sides now. Okay? Yes. Also, for the people whose shoulder is very tight here, you might tend to get a good stretch in your anterior part of the shoulder. Okay? And go. That's your 1. Breathe out there. And come back. 2. 3. 4. 5. Good job. Amazing work, people there. Lie down for a 10 second, sip some water, or feel free to do the diaphragmatic exercise that I have taught you before. Okay? Let's take a short 20-second break. Okay, time to resume. Hopefully everybody's back. We'll sip some water. The next exercise that we are going to do is called as a mermaid stretch. Pretty interesting stretch, okay? So for this, I want you to sit in a something called as a Z position, okay? So if you're sitting, for the people whose hips are very, very tight, might find it difficult at first point to sit in this position, but in that case, you can just, relax yourself and sit like this. But in case if it's not tight, go ahead and sit into this position where your right heel are just beside your right button, and then your left heel is going to touch your right knee. Okay? Now, your one hand is going to be here on the side, one hand is going to raise up as high as possible. Okay? Your left hand supporting on the mat, and slowly you're going to slide your left hand again. Do not collapse with your thorax there. You're going to keep it straight, erect, and open as possible. Now, stretch your hand and go on the side like this. Feel this complete stretch on the lateral part of your spine as well as on your lats. Okay, that's your one. We're going to do two sets of this, 5 reps. Keep sliding. Two. Stretch the arm completely. Do not collapse from your thorax. Keep it as open as possible. Okay. 3. Good job. 4. Come back. 5. Come back. Good job. We're just going to switch the side now and do it on the opposite side. Okay? Make sure you're getting a very, very good stretch at your lats muscle. Now, basically, I forgot to tell you what is the lats muscle. So, basically, latissimus dorsi is a muscle which connects your pelvis to your shoulder. It originates here and goes abroad. It's the largest muscle and inserts in your shoulder joint. Okay? So, let's do it on the opposite. Again, a Z sitting position. Right hand this time on the mat, left hand stretch completely up. Imagine that somebody is pulling you from up and get that good stretch in your lats. Okay? Slide this hand slowly. Let's do 5 reps there. Do not collapse through your hips. Open it. There you go. 1. Come back. 2. Come back. 3. Come back. 4. Come back. 5. Good job. So there we are now. Mermaid stretch. Let's do one more set quickly on both sides, 5 reps. Again, Z sitting. The people whose hips are very, very tight are going to feel a lot of, pull in their hips also. It's a bonus for them. Okay. Again, on this side, let's do 1. Come back. Feel the good stretch on the side of your spine. You can hold there for 5 seconds if you want, and come back. Let's do it again. 3. Come back. 4. Come back. 5. Come back. Good job. Do not hold your breath by any chance in any of the exercises that we are doing, okay? Switch the sides again. 5 reps. 1. Do not hold your breath. Keep breathing in and breathing out. 2. 3. 4. 5. Stretch the arm and come back. Perfect. There we have finished our exercise called as a moment stretch. We are left with the last exercise for today's session, okay, which is called as understanding what is core activation and what is a neutral spine. Now, when it comes to neutral spine, we all know that our spine is naturally an S-shaped curve. Okay, so now you have a lordotic curve in the cervical, a kyphotic in your upper thorax, and then again a lordotic. So what is this curve actually? Okay, so when you see your spine, it is always an S-shaped curve. It's going to be 1, 2, and 3. So when you see this, the cervical spine, where the concavity of your spine is directed posteriorly or at the back. Okay. When it comes to the upper back, your concavity in the upper back is towards the front or anterior side. When it's come to lower back, again the concavity is towards the posterior slash back. Okay. So now, when as we have already seen what is an anterior tilt and a posterior tilt, we know that whenever you go for an anterior tilt, there is an exaggeration of that lordotic curve. And whenever we are going for a posterior tilt, we are actually obliterating that. Okay. Now, how do we actually activate the core and what is the neutral spine? When it comes, neutral spine is a range of your spine lower lumbar area where it is the most safest to load. Again, it's a plus minus 3 range there where you understand that if you activate your core in that certain range, your spine is safe to do certain exercises which are going to come in the upcoming sessions. Okay, so make sure you're doing this exercise properly. In case of any doubt and queries, please feel free to drop it in the comment box and I'm going to answer all of those queries at the end of the session. Without getting any delay, let's start with the exercise. Okay, so we are going to learn core activations and neutral spine. So go and lie down on your back. Okay, lie down on your back like this with your knees bent, hands on the side. Now imagine I have kept a water balloon just under your spine here on the low back area. Okay, so now what if I tell you to go away from the water balloon? That's when the anterior tilt happens. Okay, and now try to go towards the balloon where you're posteriorly tilting with activating the core. Okay, so take your navel towards the mat and go for a posterior tilt. Squeeze your buttocks and smash that imaginary water balloon that we have kept. So spine is going to go for a little bit of straightening or flattening. Keep smashing that on the mat there. Okay. Now this you will be able to feel a good contraction in your core muscles, which specifically is called as transverse abdominis muscle. Okay. Again, go a little away and smash it again. Okay. Let's do 5 reps at one side of this exercise. Starting from now. Okay. Go towards the balloon and smash the balloon. Take your navel, push it into the mat, hold there for 5 seconds. You can count 5, 4, 3, 2, 1, and relax. Smash that balloon, go for the posterior tilt, and feel the contraction absolutely in your transverse abdominis. Do not hold your breath. Do not try to create that air pressure there on your abdomen. It is not the air pressure, it is the core that you have to push with. Okay? 5, 4, 3, 2, 1, relax. Let's do 3 more reps. Keep smashing the balloon there. 4, 3, 2, 1, relax. Let's do 2 more reps. You tuck in, take your navel towards the mat, pull it. There you hold. 5, 4, 3, 2, 1. A very, very important thing in this exercise is to understand the ability of your body to isolate the movement from your pelvis and the lumbar area. Try to avoid any stressing from the thorax. Okay, so relax your shoulders, relax your upper chest. Do not try to stress this out. Just keep it relaxed and differentiate the movement between your lumbar spine and the thoracic spine. Okay, let's do 4 more reps. Tuck in. 5, 4, 3, 2, 1. Relax. Again, 3. Do not hold your breath. You guys can also count, okay? So that you know that you're not holding your breath. And relax. Tuck in again. There you go. Smash that balloon there. With all activating your core. 5, 4, 3, 2, 1. Relax. One more. Tuck in. Keep smashing that balloon. Take your navel towards the mat. Keep counting. 5, 4, 3, 2, 1. Relax. Good job. So here we have learned something called as core activation and the neutral spine. Do not raise, just be in that position. You're going to cool down with the diaphragmatic breathing. In case if you were late to join the sessions, don't hesitate to learn this exercise right now, which we have done as a warm up, and we are going to do same exercise as a cool down called as diaphragmatic breathing. Okay, so for the diaphragmatic breathing, be in the same position, one hand on the epigastric region, one hand on the upper chest. Make sure you're breathing in with your nose again, filling all that air in your tummy, filling all that oxygen inside. Okay, and then breathing out with your mouth and relax. Feel free to close your eyes and let's do 4 reps of these breaths and then end the session. Okay? Breathe in. When you're breathing in, I do not want any movement coming from the thorax. It is all from the diaphragm. Okay? So breathe in, breathe out. Breathe in, relax your shoulder joints as much as possible. Do not stress over your thorax. Okay? Feel all the air filling into your tummy. Feel that your right hand or the hand over your epigastric region is ascending as well as descending. Breathe in and the hand will ascend. Breathe out with your mouth. The right hand will ascend. Make sure that this is minimal or no movement on your left hand of your thorax. Let's do one more last rep. Good job. Here we have done with our cool down. That is a diaphragmatic breathing exercise, which actually helped us to get all that oxygen inside and replenish the carbon dioxide and push that carbon dioxide outside. That was the end of our first session of this program called as a Back on Track. I'm going to quickly recap what we did in today's session. So in today's session, we started our warm-up with a diaphragmatic breathing exercise and we ended up with a diaphragmatic breathing exercise. Okay, that was a warm-up and that was a cool down. Okay. For the rest of the program, what we did was the first exercise called as cat and camel. The second exercise that we did was thread the needle. The third we did was an open book. And the fourth we did was a mermaid. All of this was mainly focused on the mobility and was pretty easy. Okay, but the upcoming sessions that are going to be for this program are going to be a little difficult. So make sure you're very, very thorough with this session and keep doing and moving yourself again and again. Okay, sip some water, wipe off that sweat if there's any, and please feel free to put any queries in your comment box. And I'm going to see if there are any queries right now, and I'm going to answer for that. Okay, so it seems like everybody is not having any queries there. It's just all the good morning messages. Fine, so we are ending up our session today here. And so, are there any queries? Okay, no. we end our session here and see you in the next session, guys. Bye bye. Have a good day.